Okay, so welcome everyone. Thanks so much for joining us today. I am Andrea Zotinka, Circular Healthcare Project Officer. I've been in touch, I guess, with many of you to confirm your participation. So very glad that you came to Brussels today to join us. So okay, today we will talk about circular healthcare and how to implement it. I guess the clicker is not working. Okay. I guess most of you filled in the survey by now, so it's too late to do it now, but thanks for everyone who did it. Very helpful. So today, I forgot I have a screen here actually, so I don't need to look there. So today we have a presentation from quite a big part of Europe, I think. I'm very happy to see also more representation from Eastern Europe starting to appear at our event, so that's really great. I'm also from Eastern Europe myself. So this is from where we are all here today, basically. So welcome to everyone again. So why are we here? And I don't mean why are we here to learn about circular healthcare, but why we are in this particular space, which is called the Circularium. This is a sustainable space in Brussels. It used to be an industrial surface that was used for automotive industry, like making cars and everything. This whole area was very industrial back in the day. And now they're trying to retransform it, to recreate it, to make it a space for local innovation and sustainability and circularity. So it is quite a cute space, and that's why we chose it. There's also there is an interesting concept store. It is a free store where you can take one thing and give one thing back. You don't need to pay with money, so that's pretty cool. And there's lots of cool organizations on site. And this is what it used to be before, just to give you a little introduction of the space. Some logistics. First of all, not everybody here is a native English speaker, so keep that in mind when you are talking, presenting, making comments or questions. Just to maybe not talk too quickly. And of course, if ever there is a problem with the language, if you don't understand anything, feel free to raise your hand and tell us. No shame in that, just you can tell us to repeat or to rephrase or whatever. I'm not a native speaker either, actually. So there will be some discussion moments during the day. So I encourage you to sit with strangers and people that you don't know, because maybe you might learn more from them, but no pressure in that. I mean, if you don't feel comfortable, it's always nice and safe to be near someone that you know, so no worries. Do keep your phones on silent mode, but if you need to take a call or do some work, you can go like a bit further there. There is enough space here, I think. We will have a lunch break from 12:30 to 1:30, where there will be lunch provided. And there will also be 2 coffee breaks, in the morning one and in the afternoon another. And the Wi-Fi, this is a bit of a hot topic today because it's not working properly, but you can try to connect with your phones. For me, on my phone, and for many people on the phone, it works. So this is the Wi-Fi name and password. It's still a bit problematic to connect on the laptop, but we are working on it. So it works now? Oh, OK, it's been confirmed. It works. Everybody connect on your laptops, but do also please be present here as well at the same time. And then the toilets are right there. There is a sign. They're there. OK, so now we will start with a little icebreaker, just to move a bit. So I guess I can start already to slowly dive in what we're going to do today. So this is the agenda for today. We will start in the morning a little bit about, to talk a bit about the basics of circular healthcare and plastics. Then we will talk about chemicals, toxic-free circular economy, and also more specifically, we will talk about PVC. We will have a coffee break at 11 for 20 minutes. We will not cut from the coffee breaks, no worries. Then we will talk about some common myths related to plastic reduction, and we will try to debunk them. And after that, we will slowly go towards the actual solutions, and we will hear from our speakers what they are doing to make healthcare more circular. And then we'll have lunch break at 12:30. And not working? Okay, and this is the agenda for the afternoon, when again we will follow the waste hierarchy and see examples of reduction and reuse from healthcare. And at the end of the day, we will talk about reducing harmful chemicals through sustainable procurement. And the closing will be towards 5:15, 5:30. So it's quite a packed agenda, but we try to put some discussion moments here and there and some breaks, so I hope it will be okay. But if you ever feel overwhelmed, feel free to go like relax on the armchairs there, which we put especially there for you, for the overwhelmed people. The clicker or the slides? Is it? Okay, now it's working. Okay, so I will start by talking a little bit about us and who we are. I guess if you are here, you maybe know us already. At least you might be subscribed to our newsletter or something. But just to be very brief, we are Healthcare Without Harm Europe. Nobody seems surprised, so I guess it's fine. So we are a network of healthcare organizations and healthcare professionals working to make the healthcare sector more sustainable. So the healthcare doesn't do any harm to the planet or to the patients. We have multiple action networks. One, the Global Green and Healthy Hospitals, it's our oldest ones, and this one is more for organizations. And then the other three are for individuals. So we have our action networks for doctors, nurses, and pharmacists. So if you are any of these three, you can join, or you can also join as an organization. And for the Global Green and Healthy Hospitals, we have 183 members in 25 countries across the WHO Europe region. But we also have our other teams in the US, in Latin America, in Southeast Asia. So we have members from all over the world, basically. So a lot more than 183. These are only for Europe. These are our program areas. We work across 3 programs. There is Climate Smart Healthcare, where our climate team works on reducing the carbon footprint of the healthcare sector and also making it more resilient in the face of climate change. We have the Circular Healthcare team, which is organizing this event today. And then we have Safer Pharma, which is working on reducing pharmaceutical pollution and also reducing the development of antimicrobial resistance. Okay, now to go towards Circular Healthcare, so our team organizing this today. Our strategic goal as a circular healthcare team is basically to reduce the use of resources and reduce the amounts of waste created in the healthcare sector, while also making it more toxic-free and making sure that the supply chains are also ethical, so also protecting the human rights and labor rights of the workers in the supply chain. So far, we have done quite a lot of work on plastics, but we're also working on sustainable procurement and reduction of harmful chemicals, to be more concrete. And one of the reasons why we are also organizing this event today is that I feel like many people have very different definitions of what circular economy actually means. For us, it means this, like really reducing the use of resources as much as possible. And I also wanted to ask you, I completely forgot I had this slide there. So, if you already managed to connect to the Wi-Fi, which apparently is working, or if you have your own internet, if you can scan this QR code and tell us in maximum 3 words what circular economy means to you. Okay, I think we already have quite a few words here. So I'm happy that the crowd here is particularly on the same page as we are, basically, because for many people, circular economy, they often associate it with recycling directly, and they kind of skip the reduction and reusing part. But you can see that it means a lot more, like also efficiency, no more waste. What else is there? Green, sharing, stopping, less consumption. So it can mean a lot of things for, for everyone. But I think, yeah, reduce, reuse, recycle are the most common words. But I guess I also won't spend too much time in the very basics then, because I think like you are particularly well informed, so good job. Can we go to the slides back? Thank you. Oh, true. OK, so this is, I think most people in this room have already seen this video, so I won't show it to you right now. Yes, I have some notes. But there is the link here, and the slides will be shared, so for those who haven't seen it. This is basically a woman who was diagnosed with breast cancer. She had to do a surgery, and she wanted to do this kind of artistic project of the waste that was created during her surgery. And you can see here, I think visually it's quite impactful, and this video, I have seen it shared many, many times, and also everybody in this room has seen it. And as you can see, most of the waste surrounding her is actually plastic. But I wanted to go back a bit to the different definitions of circular economy, because for me, when I see this video, the conclusion that I draw from it is that we need to use less, we need to reuse more, and to create more waste. And then I also heard people presenting this very same video saying, oh, I see this video, and I think that we need to recycle all of this. So again, this just shows that people draw very different conclusions of what circularity means and how we can solve the issue of the waste in the healthcare sector. So I won't stay too much on this, but basically, the circular economy, very basically, in very simple terms, is a model of consumption and production where the waste is reduced as much as possible and where the resources are also, resources used are reduced as much as possible. And we want to focus also in the circular healthcare team here, we want to focus as much as possible on the blue part of this image. And the recycling part really only comes at the end of everything. When you have already done and tried to do everything else, that's when, at the end of the life, of the very long life of a product, that's when you go for recycling. And of course, throughout the whole process, we need to also think about the harmful chemicals that are used in these products and try to make them toxic-free. This is the waste hierarchy, which we are, I guess, most people, I mean, I don't want to assume, so maybe I should still explain it, because some people, we are on different levels here, I guess. So this is a tool that we can use to choose our actions on how to reduce the waste that when we want to reduce the waste that we produce. And as you can see, it is divided in two parts. There is the prevention part on top and the waste part on the bottom. And again, we want to work as much as possible on the prevention part. We need to reduce the amount of waste that we create. And even when we send an item to recycling, it is still waste. We still put it in the waste bin, and sometimes you don't even know what actually happens to it. So we really want to focus on the prevention part. And again, phasing out harmful chemicals throughout the process. And now, moving towards plastics in particular. So today, we will focus quite a bit on plastic, but not only. Some of the speakers will also talk about other items that they have worked on. But plastic is quite an important topic these days. So why is it important to focus on it? So first of all, plastic production and use is growing quite uncontrollably. So if you want to put this a bit in perspective, just 30 years ago, we were using 4 times less than what we are doing now. So in 30 years, we are using 4 times more. And by 2060, the production will even triple. So it will grow even more. And this is worrying, because we can see already that we are not really dealing with the problem very well. Like we are overwhelmed. I feel like as a society, we are a bit overwhelmed by the amount of plastic that we create, that we use, all the plastic waste, everything. So you can imagine, we are overwhelmed now with the amount that we are producing now, but how will it be when we have 3 times more, when we cannot even deal with what we have now? So this is already worrying. In general, plastic has really facilitated the switch towards single use, not only in healthcare, like in our daily lives, everywhere, basically. And it was not always something that we needed, It was not always consumers asking, we want these single-use plastic items. It was very often the producers who were creating it and giving it to them and telling them, you need this right now. But it was not always needed. And we see also in healthcare a lot of situations where we use single-use plastic, but it is not necessary. So just to give you like an example, but we can talk about it for ages because I have many. But we were hearing a presentation from someone in Sweden at a hospital there who were suddenly using a lot more disposable scrubs. So just the scrubs, which I think in most places in the world they are reusable. But they were really growing the rate of single-use scrubs. And they noticed that there were a lot of misconceptions among staff about these single-use scrubs because they were thinking that the single-use ones are cheaper. They were thinking that they are safer. They were even thinking that they are better for the environment because they were saying, okay, maybe less water used to wash them, But they managed to do like a communication campaign, and I think it is really a great one, actually, where they tried to clear out all these misconceptions because it turned out that the single-use ones were actually more expensive than the reusable ones. While they did increase the amount of single-use scrubs, the infection rates remained more or less the same. So they couldn't say that the infection rate dropped because they increased the single-use scrubs. So there was not a correlation between those. And also in terms of environment, again, this, when you look only at the water, maybe the reuse can lead to more. But if you look at the whole picture, which is what we should look at all the time, the reusable ones are always preferred for the environment. So these are maybe the main reasons why we want to focus on plastic. But of course, there are other materials that are also very important. So we did one of our member hospitals did this staff survey on plastic waste, and I wanted to share it with you because I think the results are quite interesting. They asked quite a big amount of their staff. I think it was maybe around 300 people. So of course, it's not in a hospital. There are thousands of people sometimes working, but I think it's still a good representation. And they asked if, in general, they think that plastic use can be reduced in their practice. And 71% of them said, yes, they think that. And actually, in the survey, we also asked in the survey that we sent to you if you think that there is too much unnecessary use of plastic in your facility, and it was like a 100% yes response. So we are all agreeing that we are using too much of it. And also, when they asked if they would be willing to make an effort in their work to reduce the plastic use, the big majority of them were willing to do it. So that is also encouraging when you think about it. And also, I wanted to share this other question that they asked because I think it was also interesting. They asked if the staff knew how the waste was managed in the hospital, and the majority didn't know what happened. So I think this also shows that people don't really know what is happening to the plastic item once they throw it away. So I think this also marks a bit a lack of knowledge and the need to inform people better. I think I might skip this for a while because we just did one like 2 minutes ago. So you can just think about it, like what impact do you associate with plastic in your mind? Or if anyone wants to like actually say it, like we can also, we don't need to use this technology. Does anyone want to say the impact that they associate with plastic? No need, don't feel pressured to do it, it's okay. So I wanted to really go a bit, wait, just checking the time, it's okay. I wanted to, oh, sorry about that. I wanted to really go a bit into the basics of plastic. So what is plastic? And this is its life cycle, basically. So plastic is 99% of it made from fossil fuels, which are oil and gas mostly, sometimes also coal, but most commonly oil and gas. So plastic is born first, the first moments of its life, come from the oil and gas extraction. And here we already know the environmental impacts that that can bring. It can be the destruction of ecosystems, of landscapes, harming the communities that live around these areas, these extracting areas. And of course, also, I think we have all seen so far some accidents that have been happening in this moment of oil extraction. And they are most often quite tragic, these accidents, very harmful for the environment, animals, people living around them. So this is the first step. Then there is the refining and manufacturing, which is a very energy-intensive process, and when also there are a lot of harmful chemicals that are being used to create the plastics, and those are also, a lot of them come from oil or like from fossil fuels. And again, this can be harmful for the environment around it and for the people living around these areas. And this is, I mean, maybe sometimes we imagine this somewhere far away, but this is actually quite close to us. Here in Brussels, we are very close to Antwerp, which is a big petrochemical hub, and where they create a lot of plastic. And actually, they want to build a new factory to make more plastic. So we are, you know, it's not like the effect stops at the Antwerp borders. You know, it doesn't have borders. So we are also affected here and throughout Europe by the harms brought by this. Then there is the product use phase, which I guess most of us know about it. We use the plastic, it's everywhere. It's everywhere, no, not to sound too scary. And we will talk a bit more about the impact of, on health, especially. And at the end of life is the product disposal. And at the moment, most plastic, whether we want it or not, is actually incinerated or landfilled. These are the most popular end-of-life scenarios. And when it is incinerated, again, it pollutes a lot. It creates a lot of harmful chemicals. And when it is landfilled, I think we have all seen photos of landfills, how they look like. Again, they can pollute, they can disintegrate in tiny pieces, the chemicals go out of them, and they can pollute the soil, the water, the air. So you can see that throughout its life cycle, plastic is quite damaging to both human health and environment. So I think we were like mostly aware about the waste impact of plastic. You know, we often see it, you know, all the, I don't know, the beautiful, pristine beaches full of plastic, you know, or animals that are entangled in them. So this is the most visible part. But actually, plastic impacts the environment across the triple planetary crisis, which is climate change, pollution, and biodiversity loss. So in terms of climate change, I have already showed you how plastic is so much linked to the fossil fuel industry. And you know, we are seeing more and more change to distancing ourselves from the fossil fuel industry and maybe moving more towards renewable energy. So the industry is now investing quite a lot in this petrochemical and plastic production as kind of like a backup plan. Let's say it like that, let's call it like that. So they are very closely linked. And this is a tweet by Secretary General of the UN, Antonio Guterres, who said that that plastics are fueling the climate crisis. And it's not him who said the second sentence, it was actually a report that showed that by 2040, up to 19% of global greenhouse gas emissions will come from plastics. So that is actually a crazy amount, 20%. It is a lot. So as the point is that we cannot, we talk a lot about stopping at 1.5 degree global temperature and net zero and reducing emissions, but we cannot do that without also addressing the problem of plastic and reducing it as well. And then in terms of pollution and biodiversity loss, I think those are maybe more obvious, but as I said, from the life cycle of plastic, there is a lot of pollution created, and also the microplastics, which are tiny pieces of plastics, that are also polluting the environment. But we will talk about that a bit more later, about the impact of plastics on health. Just to be very brief about it. The impact of plastics on health comes from two sides. On one side, there are the harmful chemicals that are being used. There are around 13,000 chemicals used in plastic nowadays. We only know something about half of them. The other half we don't know anything about. We don't know anything about the risks that they present to health or environment. And for around a quarter of them, we know already that they are harmful to human health. They are hazardous for human health. But we are still using them. And then the other impact comes from the microplastics. So, when plastic breaks down, it becomes these tiny pieces of plastic. It can also be from our clothes, when they go into the air, from tires in the city. And so far, there have been many studies that have shown that we have microplastics in our blood, in our lungs, in human placenta. So it has been found in human bodies. So far, it is hard for scientists to do a study that says microplastics lead to this disease. So this has not been done yet, but they say what it might lead to. So I think a recent one was showing that it might lead to obesity, for example. They are very worried about the way this foreign materials in our body can affect also our cells and everything. And something also a bit worrying, that it worries them, is that when they are particularly small, the microplastics, so then they become the nanoplastics, they can also potentially pass the blood-brain barrier. So this is, again, a worrying aspect, but we still need more research to show the exact impact. But that doesn't mean that we shouldn't reduce it already, because we are, scientists are already worried about it, and are already telling us that we should be careful. So I don't think we should wait for this research to appear before we act on it. So these are some of the impacts of harmful chemicals that were found in plastic on health. So for harmful chemicals, there have already been a lot of studies being done, especially for things like phthalates or bisphenols, but we do have Dorota, who just arrived, who will talk about it in more detail in a little bit. But basically, some of these chemicals have been linked to reproductive health impact problems. They have been linked to damage to children's brain development, certain types of cancers, and also diabetes, obesity, hypertension, and many more issues. And I did put a photo of a child, a little baby, here because they are the most vulnerable group. Okay, moving on to the plastics that we find in the healthcare sector. And we will go back to the health impacts in a little bit, just after this. So we have looked, we have done 3 years ago, we have done a project towards plastic-free healthcare. And during this project, we have conducted waste audits, and we have also looked at procurement data from a few hospitals that were working with us, to kind of make an overview of the plastic items that are found the most in healthcare. And this is the data from one of the hospitals, but it was very interesting to see, and I think also quite representative for all the others as well. So they have shown that 6 product categories were representing more than 60% of the total plastic that they were using or producing annually. And this is quite interesting to see, because it can already help us maybe make a selection of the plastic items that we should focus on the most. But you can see here, for example, quite a crazy amount for disposable gloves, almost 18% of the total plastic, which is quite in line with what we have found. Disposable gloves were always the item that was purchased the most. And we will also hear later today about how we can reduce the amount of disposable gloves. So there are ways to do it. Other items that were found were IV solution bags at 11–12%, disposable protective clothing, or maybe disposable textiles in general. They represent quite a big amount of the total plastic in healthcare. You can also see, you could see it in the image that I showed at the beginning. You know, most of the things around her, the gowns, the drapes, those were mostly textiles. And they are also quite bulky and big, so they represent a big chunk of the total waste. Then there are syringes and nappies or incontinence products and IV systems. These are some of the findings from our first audits. You can see, so first of all, just like as a disclaimer, we only looked at some words I put in parentheses, so not at the whole hospital. Did something happen? Oh, sorry about that. I had a sign from my very helpful colleague. Sorry about the disturbance. So these are some findings. So as I said, we only looked at some words, and also we did not look at infectious waste. So it is not representative of the whole waste coming from a word, just as a disclaimer. But it was still interesting to see, and it's also a good exercise to maybe raise awareness, because it's very visual, you know, to see all this waste in one place and go through it. And some people in this room maybe have already done a waste audit. Great. So you can see here that gloves were above 10% of the total plastic waste for all the hospitals. There are also a lot of wipes, especially in UK. We felt that wipes are used quite a lot more than in other countries. Then nappies, because we did look at, we tried to look at neonatal units or maternity wards, because that's where the most vulnerable groups are. And of course, gowns, medical packaging, and so on. And we did again some waste audits last year. And that was also very interesting. And the results were more or less similar in terms of the main items that were found the most. We found, in some cases, a lot more gloves. Like sometimes they were representing 18, 24% of the total plastic waste. So that was interesting to see. There was more packaging waste that was found. And also this time we looked at some patient wards as well, where we found, of course, maybe less of the medical items, but more of the food packaging or food contact materials like cups, bottles, snack packs, and things like this. So, you know, the non-medical part of plastics in healthcare, I think, are also a very good topic to look at. Maybe it might be a bit easier to address in some cases. So you could consider maybe looking at this, because they do represent quite a big amount of the total waste as well. And this is just a study that was done quite recently, I think maybe in spring this year. That was, this was looking at the operating theaters in particular. And operating theaters create, I think they are the part of the hospital that creates the most waste. From 21 to 30% of the total hospital waste might come from operating theaters. And this study has shown that around 23% of the products that were used in, I think they looked at 5 common surgeries, this 23% were responsible for more than 80% of the total carbon footprint. So again, it shows that a small amount of products, that maybe they are used in large quantities, but still, they represent a big environmental impact. So it's also maybe an indicator to look at those first. Okay, so what do we do about all of this? Again, I bring back the waste hierarchy. You know, we try to look at the product categories that make most sense for us and kind of go through the waste hierarchy without trying to skip to recycling, which I see it a lot. And I'm sorry that I repeat it so much, but it's just that I see a lot of going straight to recycling while skipping the other parts. So we follow the waste hierarchy. And if you wonder where to start, I think this can depend so much on the local context or your facility, or even what you want to work on and what the staff is interested in, because it is very crucial that all staff, or the majority of staff, is on board to this. You can look at the largest volume items or departments, so what we have shown earlier in terms of the item categories that were used the most, but of course this can differ, so I do encourage you to look also at the procurement data, do some waste audits if you want to. So you can look at those. The departments, as I said, operating theater generates quite a lot of waste. I've also seen, I think, a recent study not sure if it was super recent, but it was saying that delivery rooms also generate quite a lot of waste. So you can see in your own context what makes most sense for you. You can also try to look at the most vulnerable groups which are impacted by plastic. So this could be around the maternity ward, the neonatal intensive care units, where plastic reduction could have a positive impact on the health of the people there. Also, you can look at the maybe easier or like low-hanging fruits, like food contact materials, again, which might be a bit easier to change. And we also know we use reusable plates and cups and forks in restaurants and everywhere. So, and we trust these restaurants that they are well cleaned. So why not trust it in the healthcare setting as well? If anything, it would be even better cleaned, I would think. And also, something that you could look at is where items like in your healthcare facilities, there might be some items where there are single-use and reusable options available, both of them. So you can look at how you can increase the amount of reuse. So this was the case of the scrubs that I told you earlier. Both options were available, like staff could pick between reusables and single-use. Most of them were picking the single-use, and they did the work to raise awareness on why it is not necessary to pick the single-use. So you can also look at these items, because since you are already using it, it might be easier to kind of increase the rate at which you are using it. It is also important to learn from others, which might sound a bit cheesy. But you can learn from the people here in the room or from other hospitals in your region, in your country, or in the whole world. I wanted to share these results from a study that has been done. They were comparing the emissions from cataract surgeries from the UK and from India. And in the UK, the emissions were 30 times higher. And they also looked at another study looked at the infection rate as well. And in India, the infection rate was actually slightly lower, a little bit lower. So you could see that, all this single use, because this was mostly due to the single-use items that were being used in the UK and less efficient systems. So all this single use, it didn't necessarily bring an increase in or a decrease in the infection rate. So I think it's important to kind of look around and see what the others are doing, because we as Healthcare Without Harm, we talk with a lot of people from a lot of hospitals, and we get to see so many amazing examples, but they're kind of like here and there, like around Europe. And it would be, and we're trying to share them with you. But I think there should be more maybe collaboration between the hospitals across your country, Europe, and so on, to learn more from each other. And sometimes, actually, now I think about it, you can also even learn from your own hospital, like from people, because people in different teams might be doing completely different, might have completely different ways of doing something. So you can also learn from them. I'm talking, test, test, testing. I'm testing the mic, okay. Okay, I think it's good, right? Okay. Okay, everyone. Okay, some very rich conversations happening here, which is good. Okay, we will get back to... Okay, I'm glad that you are all making friends. It's nice. Okay, so we will go back to the impact of plastics on health in a little bit, but does anyone want to share anything of what they discussed? If you want to. Maybe you talked about random things. Maybe you didn't even cover these questions, which is also fine. It's getting to know each other also. It's good. Okay, for now it's still okay, but we will have a couple of other discussion sessions where there will need to be somebody to report. But now it was more like a test, so it's okay if nobody wants to do it. Last chance? Okay. Yeah, could everybody hear what Diana was saying? Yeah, this is quite interesting debate. We do know of a hospital in Spain that switched to reusable guns, and they knew that the water, like they were using a bit more water because of that, but they still made the change because they thought that overall the impact was better for the environment. I think it's a bit of a vicious circle in a way because, okay, maybe in a particular place you want to reduce the strain on the water use to not use so much water, but then by using all the single use, which is maybe produced in a different part of the world where they might be witnessing some similar harms on their ecosystems, on their environment. So I think we're kind of like pushing the problem somewhere more far away. And in the end, it will still come back to us because we are impacting the environment there, but it won't stay just there. It will come back to us where we will have even less water, if that makes sense. Did that make sense? So it's a bit of a vicious circle, but it's true, it's a fair point to make and something that needs to be addressed as well. But I think it is important to look a bit at the whole picture, at all the impacts, and also to not try to put your problems on someone else's shoulders either. Does anyone else want to share something? If not, then yeah. Mm-hmm.
So I work for a hospital, and what we are discussing is that yes, we don't want to have single-use plastic items. So you go to like how we can clean it and sterilize all the stuff, but then all the logistics behind it, you have to collect it, you have to bring it somewhere, you have to clean it, and it needs to dry somewhere, so you need space. So I think it's not always just about water. There are other dimensions, and sometimes I'm not saying it's too complicated. The whole topic is too complicated, but there is a lot to consider when you want to kind of get rid of single-use plastics. You want to go more into let's just kind of clean those items on the side, or even if you want to send them somewhere. Again, that's another logistic dimension if you're sending it to a company that will do it.
Yes, for sure, and thanks for bringing that up. It's true that I didn't mention it earlier, but it is kind of a crucial factor to think about. A lot of hospitals, all hospitals used to use reusables before, and then they switched to single-use, and in the process, all the cleaning, sterilization facilities closed. And now they want to go back, and they are closed, so they need to open them back again. So indeed, it is a logistical challenge. I do believe that on the long term, it brings benefits, but at the beginning, it is tricky to do. But maybe that is also an argument to kind of work together, maybe put more hospitals together that can use the same sterilization services or cleaning services, maybe it can be an opportunity for collaboration. But it is true that it's something that we need to think about as well, all the logistical aspects.